Well, good morning, and the first instruction was to get on the big red circle, so here I am. They have a hook that will take you down, or a hole if you talk too long, so I'm going to try to stay on time and be focused on the purpose of today, which is a great purpose. I wondered when asked why I would be speaking at this event, having been at the same location for 44 years. It was simple to say that it has been 44 different years rather than the same year 44 times. And hopefully that's an indication that we are always on the move, that we have things yet to do. And that's the privilege of having been in the position that I've had through these years. So we welcome you this morning. It is a time to think ahead, to really revive, as it says, the opportunities that we have as an organization. First, three axioms that I'd like to share, things that have been true and will continue to be true going forward. And that is, what got us to where we are today probably will not get us to where we need to be tomorrow. The second is, change for us is a single constant. So we are always moving things, changing things, going forward. And we must look at the past not as a hitching post, but as a guidepost. And so those things continue to be true as we think about our opportunity to improve the health of the people in the communities we're privileged to serve across North Texas. So what I'd like to do in the few minutes that I have is talk about first the trends in healthcare that are being advanced not only locally but regionally and nationally, and then what THR has been doing from an innovative point of view to address some of those changes, and third, what is our future state? What do we have the opportunity to do going forward? So I think, as we all know, looking at the media that we see, the changes that we know as we do our strategy, the healthcare environment is changing rapidly. First, from the employer standpoint, employers are saying we want to continue to provide support to our employees. We want to be less accountable than we've been in the past and reduce our costs. Employers are also saying we want to narrow the network of organizations that we work with to provide care to our employees. Indeed, find those organizations that we can rely on to provide the services that our employees need rather than the entire environment that we're in today. And third, they do want to shift the responsibility of healthcare more to their employees. Higher deductibles, higher co-pays, paying for folks who will stay well, and really penalizing folks who are employees who are not caring for themselves. All of those trends are moving at a rapid pace. On the provider side, that's all of us. The fact that we are providing service to 6.5 million people across North Texas is a remarkable opportunity that we have. But the trends are, we're seeing more and more providers expand their caregiving beyond just the physician to nurse practitioners, physician's assistants, and creating certainly a team approach in providing care. We will see providers advance more on-site clinics in industry and in other locations where care can be given away from the traditional hospital setting. And so we will see these on-site clinics and other elements be very innovative in what they do. Soon you will see Texas Health Resources inside the CVS stores. And so we will begin to get into the retail side of healthcare as we go forward. One of the most critical elements, I think, as we watch trends is the alignment that's taking place between healthcare systems and their physicians. Traditionally, the physician has been a member of the medical staff. They have provided care through their knowledge and their skills and their education to the patients who cross the threshold of our hospitals every day. And certainly that is their primary reason for being in life, is to care for people who come to them needing assistance. But now, as we look at the trend, and what's going to be critical is, where is the physician in the alignment with us about how do we create our future? Where are they as we sit down to talk about new strategies outside the walls of our traditional hospitals? They've got great brain power. Beyond just their training and education in science, they also have creative minds about how they can be aligned with us as we create new ways of delivering care, particularly physician-driven population health. And so you will see that trend continue, and THR will take a lead in that. You know, tomorrow's healthcare systems will be more than just the traditional box. And we've talked about this multiple times, that in fact, we will see a long dining table with the hospital as its centerpiece, but to the left and to the right, we will see prevention and wellness and opportunity to keep people out of the hospital. And then on the right side, should they go through the hospital experience, how do we keep them from returning to the hospital? And therefore, you'll see a lot more around rehab, about long-term care, certainly about home care, nursing home care, hospice, and palliative services. All of those are now into the accountability of what we do as a healthcare system, and physicians' involvement in that is going to be critical. The other important trend is that not only do we work hard to recruit great people to Texas Health Resources, our critical opportunity is to retain them. People like yourselves who choose to come every day and give of yourself on behalf of the mission of improving the health of the people in the communities we're privileged to serve. Recruitment is one thing, retention is clearly another, and that will separate organizations. So how has Texas Health truly been innovative since its inception in 1997? So many examples, but one that I think you all are recognizing and seeing as making a difference, and that is how we are leading this organization. And the structural modifications we made about 1.5 years ago are playing themselves out in a very positive way. The dyads of leadership at the system, the dyad of leadership at the zone, and the triad of leadership at each of our hospitals is making a difference in how we bring together the operational and clinical needs of those, again, that we serve each and every day, and that give all of us an opportunity to be better aligned with leaders who understand what we do. And so we're seeing the advancement of these triads at the hospital, the dyads at the zone, and at THR, truly making a difference in how we are incorporating all of our opportunities to make healthcare truly healthcare and not just sick care. You hear us talk a lot, and we will continue to talk a lot, just as you saw on the video. How do we keep people well? And well-being is more than wellness. We know that wellness really relates to health. Am I exercising? Am I eating appropriately? Those are important, but when we step it up to well-being, it says, how do I relate to others? What's my level of happiness? What's my level of really feeling engaged and my overall sense of being an individual and a person? So we're taking innovative approaches. Right now, the Blue Zone Project in Fort Worth. Mayor Price will be here this afternoon. You will hear the energy and excitement that the mayor of this major city has for what we're going to do to change Fort Worth to be a healthier city. That's part of who we are. We must keep people out of our hospitals. That is innovation. 2/3 of the hospitals in this country are still trying to figure out how to fill their beds. We're trying to figure out, yes, that's the centerpiece of who we are, but how do we keep them out of our beds because we're keeping them well? The Blue Zones Project will do that. Our Texas Health Population Health Education and Innovation Center that Dr. Wynn is leading is on the move. This is a new concept for us. Taking our population health, taking the education that we provide all across THR, and creating a center where innovation can be free and open and advancing. That will be another step in how we advance where we go. The other, and I think you all are familiar with this, as we just announced it a couple of weeks ago, but been working on it for quite a long time, and that is that we are now going public in the movement and announcement and sharing of our performance on a clinical basis. Transparency is innovation. Transparency is innovation. Now, we have certainly created some real hum across the industry, not only locally, but statewide and nationally, that we are publicly displaying our clinical outcomes. The good, the bad, and the ugly. But we know through experience that when we share who we are and what we do, performance improves because it's out there, it's on the table, and therefore we will be able to advance it. We're also more accountable when we transparently illustrate who we are. And that's important too, that people know we are accountable for what we do every day, and therefore we are doing the right thing by being transparent and accountable. So what are our opportunities to continue to innovate? They are endless. For us as a group of people, a family of people who come together with the real opportunity to change how healthcare is delivered, and I say healthcare, not just sick care, in this community that we live in. We have the chance to do things that nobody else has done because our mindset as a family of people is proactivity rather than reactivity. We could certainly wait to hear what Washington wants to tell us, or Austin wants to tell us, or somebody locally wants to tell us about what we need to do. Forget it. It'll be there, we know it's there, but we need to be the pioneers, not the settlers. And that's where we are as an organization. That's why something like today is so important for us, that we are reviving, that we are advancing in a proactive way, not reacting to somebody else. So what will we do? What will be some of the things that you will see and you will participate in and be advocates for going forward? We must learn to collaborate with other organizations. That's been part of who we are. We would have never come together in 1997 if we didn't feel that the organizations of Harris Methodist Health System, Arlington Memorial Hospital, Presbyterian Health Care Resources could in fact work together. We are collaborators, but as we look at this continuum of care for which we are now accountable from birth to end of life, we will find new partners. And we will collaborate with them in the areas that we don't provide today, whether it's prevention and wellness. The relationship we have with Healthways is a true partnership. It is a collaboration. And on the right side of where our partners will be on the long-term care facility and rehab side. So collaboration will be part of our innovation going forward, with the understanding that they will maintain the high quality standards that we have established inside the walls of our hospitals. And we will begin to engage consumers. A lot more conversation with them about their health, their well-being. With the information that we will be sharing from a transparency standpoint on our clinical performance, they will begin to see how we are doing, where our strengths are, where our areas for improvement need to be, but we will engage them, go to them, step outside these walls that we've lived in for so many years and get to where the people are. Our integrated health campuses, now in Burleson, soon to be in Willow Park, and 4 other locations that we have identified, in a CVS store, in a variety of places where our physicians have their offices. We will begin to engage people on a proactive basis rather than a reactive basis. Engaging consumers in managing their own health and well-being is important, but we must give them the tools and the knowledge and the opportunity to make a difference. There will be incentives for people to stay well. We've had the safety net of insurance in this country for years. So if somebody's going to take care of me, why should I take care of myself? Those days are swiftly moving away, and we must be able to say that you must care for yourself so that we can care for you if, in fact, that day would come. And then to data. We will be the organization that truly creates data into value. It's not about volume, it's about value. And we have the information technology inside our electronic health system, inside what we do in terms of our metrics, to really give to those who are providing care, caring for themselves, the kind of information that will allow them to really be engaged in their own health. We will continue to deploy robust information technology. We are a leader in that across this nation. Meaningful use is something that we started on the day it was announced. And therefore, information sharing and information advancement will, in fact, change how healthcare is delivered. Those who have the information will be able to make the best decisions. And we will continue to be the developer of health informatics and information across. And those are innovative things that allow us, because we have the numbers, because we have the information, we can then make significant adjustments. So in fact, our journey never has a destination. And what a great place to be. As you know, we've had stops along our way, base camps, and soon, in the next 2.5 years, the summit of Transformation Mountain. But when we reach that summit, what do we see? Another mountain. Another mountaintop, which will be the part of our journey that we will now move to. It is about high reliability. It is about high performance that we have the opportunity to change how healthcare in an innovative way will be delivered in North Texas. We have that opportunity. We will revive healthcare for the people of this community. So as I step down, in the end of this time of many years of being privileged to work with all of you, and people have said, enjoy your retirement. And retirement, unfortunately, is not a word in my vocabulary. But what I will be able to do is refire. And refire, like revive, says there are things yet out there that we will enjoy doing that we've not been able to do for a number of years. And so as I step down and am able to reflect on this remarkable organization, I will think first of all of you, the people who have brought us to where we are, the opportunities that you've provided to us to be proactive and be innovative and advance. To be honest with you, our best days are yet to come. And what a great place to be in an organization. So, take this opportunity today to revive. Think through what we have yet to do, but always look to your left and to your right and say thank you. Thank you for being a part of this organization, and thank you for who you are as individuals. Thank you very much.